So let's talk a little bit about how you're going to organize your oral presentation. As I said before, you're going to follow the basic outline of the written record, but you do not have to comment on something from each individual section of that written record. If there's nothing relevant in the social history that pertains to the HPI, you don't even need to bring it up. If there's nothing relevant in the family history to the patient's chief complaint in their history of present illness, you can skip that in the oral presentation. Again, if the team has a question, they'll ask you about the family history at the end of your presentation. So again, don't feel it necessary to comment on something from every single header. But this is what you do need to comment on. Again, you need to give us the patient's age and their sex as their identifying data. You do need to give us the chief complaint, and you do need to tell us the HPI as a story. And then you can skip those sections that don't contribute to the differential diagnosis or your diagnosis. Now, having said that, I think it's always important to include the list of the patient's medications. You don't necessarily have to tell us the dose and the frequency, but it's important to the team to know if the patient's on 5 different medicines, what those 5 different medications are. And furthermore, if you took that history and you don't know what 1 or 2 of those medicines are, you better look that medicine up before you give your oral presentation, because that can be a real clue to their other significant medical problems. And then allergies. That's always something you want to include in an oral presentation, because that could affect the therapeutic plan that the team's going to come up with. So if a person's allergic to an antibiotic or IV contrast dye, make sure you mention that during your oral presentation. Again, as I mentioned before, maybe you don't need to mention anything from the surgical history. If it's just, again, if they have chest pain, you don't need to know about bunion surgery or that they had their tooth extracted 2 years ago. You don't need to know about their childhood immunizations if they're coming in with chest pain. So again, you could just totally skip those sections. And then when you go to the physical examination, the vital signs are vital. So make sure you make a mention of the vital signs. If they're all normal, it might be enough just to say that the vital signs were normal. But if they're not, let the team know what those vital signs are. If they have a fever, tell us what the temperature is. If their blood pressure is high or low, give us the numbers. Tell us if you checked it again yourself. And do comment on the patient's general appearance too. If this is a patient who's chronically ill and is cachectic, and